It is hard to believe, but we are 6 months into the COVID-19 pandemic. In today's 2-year well-being, we are looking at where we are now and what's next. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us. And all right, so I can't even wrap my mind around that it's been 6 months because it almost feels like 2 years since we've all been doing this.
Completely agree.
So what have we learned in the last 6 months? And I know you can't say everything that we've learned, but what comes top of mind?
Yeah, we've learned that we are still learning a lot. And so when we think about COVID-19 and our response clinically, initially, how we took care of sick people and how we're taking care of sick people now, it has changed significantly. Related to how we use oxygen and ventilators and medications that we might have used at one point, and now those we're not using anymore, and we're using different types of medications. To think that all of that has happened in a clinical environment in our hospitals in 6 months, not just in our hospital, but across the nation, it's incredible.
So because you just mentioned that with the ventilators, let me follow up with that question. Are we not using ventilators as much as we were at the beginning or at all?
Well, we're certainly using them some, but not nearly like we did at the beginning. When coronavirus became part of our national discussion, it was quite common that these patients develop a pneumonia. It looks similar to something we call ARDS. And in a normal circumstance, a lot of those people end up on a ventilator for reasons that we really don't understand. Patients with COVID-19 who develop this ARDS seem to tolerate lower oxygen levels for longer and are reasonably comfortable and don't need to be ventilated.
All right, so as we go on with that, what do the numbers look like now and what do they mean?
Yeah, we track all sorts of numbers in our state and certainly within Cone Health, and something we pay particular attention to are how many people are in our hospitals at any one time that also have COVID-19. And we're typically seeing around 50 to 60 patients at any one time in our hospitals, typically at the Green Valley campus, but some of them could be in our emergency departments as well. That number has been relatively stable for the past couple of weeks. Prior to that, we have seen peaks. We've seen lower numbers occasionally than that, but on average, we're pretty steady in the 50 to 60 range.
With that in mind, and steady is better than increasing, of course, everybody wants to know, all right, how much longer should we anticipate this whole COVID-19 thing being in our community and being this thing that is so top of mind that it changes everything we do?
Yeah, I wish I had great news to offer there. We anticipate coronavirus, COVID-19, to be part of us for the foreseeable future. We have a great data analytics team that looks at trends and transmission rate and the number of patients who have COVID-19 in our communities. And they take all of that data, in addition to a lot of public data, and estimate how many patients we'll continue to see into the next 2 to 3 months. And we anticipate that we'll continue to see in the 50 to 60, maybe 70 range over the next few months. So unfortunately, our analytics team, and they're quite good, would say that we're going to see the same number of patients that we're currently seeing.
So we're kind of in this pattern where we are, and it doesn't look like it's going to be getting much, much better for at least the short foreseeable future.
That's right.
Okay, so with that in mind, we all think to ourselves, all right, once the vaccine happens, then things will be much better. So what is the status of the vaccine from what you know at this point, and do you think people will actually get it?
Yeah, lots of questions in there. I would, first of all, the state of vaccines is that they're in trials. Some of these are even in phase 3 trials, and some of the viewers and listeners may have signed up to be in one of these trials. And these trials are looking for a large number of people to be vaccinated. They have already shown that these vaccines in the short term don't cause any harm, and so people are now getting vaccinated. Might take a couple vaccinations, and then they'll be followed over a few months getting blood tests and understanding whether any of them get infected with COVID-19 or not. We anticipate that those trials will take another few months before any data is obtained from them and any conclusions are made. So we're looking towards the end of this year in the best possible scenario where vaccines could really be available on a relatively large scale.
All right, so I'm already seeing the flu vaccine out, and it's being said, hey, you should come and get your flu vaccine. Should we get our flu vaccine, and will it help us? People are always asking that question. Will it help us to not contract COVID?
Well, I'll start at the beginning of your question. Yes, get the flu vaccine. Just get it. It's the right thing to do. It's always been the right thing to do. There are very few people who should not get a flu immunization, but it's few and far between, and those people already know who they are. By and large, we should all get it. And then to answer the other part of your question, there's no data that suggests it will help prevent you from getting COVID-19. We would think that it will help if by chance you got COVID-19 and were exposed to flu. We really think that could be a problem. Again, we don't know that data very well either, but get the flu immunization.
Okay, we're going to continue on with this discussion. We want you to be able to ask your questions, and so we invite you to text your questions to 336-379-5775. Again, these are text-only questions. We'll be right back.